All right, let's stay on health news now and turn to an alarming new study that seems to demonstrate further links between teen marijuana use and an increased risk of mental health disorders. We've covered this topic before, and now new research released Wednesday seems to provide more evidence on the issue. Researchers found that teenagers who used cannabis within the last year had a dramatically higher rate of developing a psychotic disorder than those who did not. It comes at a time when we are seeing a major shift in recreational pot use. Researchers also released new survey numbers Wednesday showing that for the first time, the number of Americans who use marijuana daily has surpassed the number of Americans who drink alcohol daily. NBC News medical contributor Dr. Vin Gupta joins us now for more on this. Dr. Gupta, let's dig deeper into the study's findings. Why are teens who use marijuana more likely to suffer a psychotic disorder? And does the higher doses of THC that we're seeing in legally available marijuana play any part in this?
Well, Joe, good morning. There is a belief that teens have an evolving brain. Their brain's still in development, and especially the part of the brain in which marijuana potentially can interfere with. And that's the technical term here is the ecocannabinoid system that regulates our functioning. It can oversee anxiety, other emotions. And that's exactly where we think cannabis, when smoked, especially high potency cannabis, can actually interfere with signaling, can interfere with brain development. And that's why we're seeing some of these rates. We really believe this increased rate, 2 to 4 times increased use or increased incidence of depression, suicidality in teens that use recreational marijuana, we think is related to how it's actually disrupting brain development.
Yeah, what are some of the mental health disorders that adolescent marijuana use has been linked to? For parents, what are some of the symptoms that they should be watching out for?
Yeah, Joe, I mean, these are going to be typical symptoms: withdrawal, not interactive as much, potentially acting out. We're seeing depression, bipolar disorder, anxiety, schizophrenia even. And schizophrenia in particular is one of those more notable psychiatric disorders that we're seeing more and more on the rise, because that's exactly what a high potency use of cannabis, this form of cannabis that's now more prevalent across America here, where concentration rates are 30 times what we've normally seen, can really disrupt that system, that signaling in the brain, and cause hyperactivity, can cause hallucinations. And so looking out for those signals, those symptoms as heralding potentially this diagnosis of schizophrenia related to cannabis, that's what we're seeing more on the rise.
I mean, this begs the question, can anyone who uses marijuana suffer a psychotic disorder? I mean, what about people who maybe have a genetic risk of psychiatric disorders? Are they then at a higher risk of developing this?
You know, these studies didn't look directly at that, Joe, but that's the essential question. If you're already predisposed, if you have a family history, if you have a genetic history, is that plus cannabis use going to yield an even increased augmented risk? We don't know that. That study didn't really look at that specific question. But when we think about other risk factors for other diseases, that's exactly what we're worried about. If you introduce 2 risks at the same time, a genetic history plus maybe a new risk like smoking for heart disease, you're really augmenting your risk. So that common sense framework makes sense here. If you have an underlying genetic history, plus you're utilizing something that we think is linked to mental health disorders, it makes sense that it's going to increase or augment your risk.
You talk about how marijuana is changing. I mean, do some forms of marijuana seem to put teens at a higher risk of developing a psychotic disorder than others?
That's the worry here, Joe. You know, we're seeing, again, THC products that have a concentration that are 30 times what we're used to. So yes, high potency cannabis across the country, even on the black market. This is an unregulated space. We're worried that these high potency drugs, these concentrations, are actually predisposing to more of these incidences of developing psychiatric disorders. So yes, concentration matters.
This is important information for teens to pay attention to and important information for parents as well. Dr. Vin Gupta, thanks for your time this morning. We always appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.